Hey, I'd like to welcome you to another episode of the Mission Matters Innovation Podcast, your source for all things innovation. My name is Adam Torres. You can follow me on Instagram at AskAdamTorres. Keep up with my book releases, book tour schedule, signings, all that other good stuff. Always love to connect with you there. And as always, if you'd like to apply to become a co-author of one of my upcoming books, just head on over to the website, missionmatters.com, and click on Become an Author to apply. All right, so today I have Dr. Arun Mohan on the line, and he's co-founder and CEO over at Radix Health. Arun, welcome to the show.
Thanks for having me.
So excited to get into today's topic. So we're going to talk about improving patient experience. But before we do that, let's go a little bit further into what you're doing over at Radix Health. Tell us a little bit more about the company, please.
Yeah, we are a technology company, and we work with medical groups all over the country, and we try to help them make it easier for their doctors to see their patients. So it's all about reducing some of the barriers to entry and reducing some of the friction that exists between doctors and patients.
That's awesome. And just so much opportunity in healthcare. And I'll just be upfront. I'm excited about many brilliant people like yourself working on these problems, because I figure as I age and as all of us age, we're going to need it more and more. So this is one thing that's not going away. So I'm excited to see people working on these problems. Let's just maybe kick it off with an improving patient experience, with telling us a little bit more about, some of those opportunity areas maybe that you find in your day in and day out.
Yeah, well, if you have tried to see your doctor anytime in the recent past, I think this will be pretty salient to you. But in a lot of places, the wait times to see a doctor are weeks out. When you get to the office, you're often waiting. That in-office experience is not what you want. And so the question that we've been asking ourselves is, how do you actually reduce delays in care, and how do you modernize that experience? So how do you take the same experience that you have with Apple or Uber or Lyft or even the airlines, and how do you bring that to healthcare? And so we've been doing this now for about 5 years, and we've I think made a lot of inroads in terms of moving the needle on some of those metrics.
Can you give us just a little bit of, tell us a little bit more of a story around this. So what are some of those inroads? Like, what's the difference, let's just say, between a healthcare system or provider that uses Radix Health versus maybe some of them that you just described?
Yeah, so maybe I'll give you a quick story in terms of how we got started, because I think that might be might paint the picture for you. So about 7 years ago, I was a physician at Emory University. I was taking care of a patient with kidney disease. I referred him to one of our nephrologists at Emory named Jeannie Sook. And so at Emory, they have this internal referral line. And so I called the number, stood on hold for a long time, finally got through. And they told me that Jeannie was booked out for 8 weeks. And this is a young man, really needed to see a transplant nephrologist pretty quickly. And I said, that's a long way out. Ended up booking something. I was going to find Jeannie and try to figure out how to get this person in sooner. Went down to the physician lounge that day, and lo and behold, ran into Jeannie. And so I remember pretty clearly what I said. I said, Jeannie, you're booked out for 8 weeks. Can you help me get this guy in sooner? And she said, I'm actually not that busy. They're doing something to my schedule. People won't show up anyway. Just tell them to come in tomorrow. And so it turns out that problem is really common. Yeah, it's the wait times to see physicians are 2 weeks plus on average. If you're trying to see a dermatologist in Boston, good luck to you. But on any given day, there's a ton of inventory that actually goes unused, anywhere from 10 to 30% of appointments. And so we've been trying to figure out, how do you apply some of the same tools that exist in other industries in order to balance supply and demand, open up new channels so it's actually easier to get in, with the end result that you're actually able to reduce delays in care, and you're actually able to fill more of those appointments, and also, as a nice byproduct, make the experience a lot more convenient.
It's amazing, and you're essentially using resources that are already there to one extent, and just creating these win-win situations.
Yeah, that's exactly right. Fundamentally it's a supply-demand problem, and there's a ton of, and it's an interesting supply-demand problem because there's actually a fair amount of demand, but there's also a fair amount of supply, and they're mismatched. And so you can actually bring a lot of the tools that exist in airlines, hotels, and other industries, and you can bring that to healthcare, and the result of it is you can actually help people get care that they need.
Wow. What kind of feedback have you gotten on the technology and otherwise since you've been doing this?
So we're a growth stage startup. So we work with about 5,000 or so providers all over the country, mostly in large medical groups. So these are groups of doctors that are 20 physicians on the low end. It could be thousands of physicians. And the response has been really fantastic. So, we have seen nice improvements in utilization. We've seen reductions in delays in care. Patients report that are much happier engaging with their physicians through our services. They're able to go online, book appointments, automatically reschedule, check in online. They're able to do a lot of the stuff that we do in the rest of the world and often forget about when we get into healthcare.
Man, that is really exciting. And when you describe it, it makes sense. And I think I don't know if I would use the word complacency, but the habit of when we're younger or whatever, just the patient experience we've had as the rest of the world has kind of moved on and gotten better. We expect more from you picking up our phone to order food and do other things in vehicles and other things than we do, and we don't think necessarily. When I say we, I'll say me. I mean, I'll say for everybody, but me, I don't think about it like, why is it so hard to go to the doctor when it's so easy to do everything else?
Yeah, and the good news is that is changing. And so historically, it's the marketplace in healthcare has been very supply driven, and now as deductibles are going up and co-pays are going up, and there's a lot more access to information, people are actually shopping. And when you're shopping, what do you look for? You look for price, you look for experience, you look for service quality. And so one component of that is availability. So, you could find the best doctor in the world, but if that person is not going to be available for 12 weeks, or it's going to be impossible to actually get in to see that person, you naturally go somewhere else. And there's a really nice, I think there's a really impressive generational shift that's happening along that too. So, if you surveyed baby boomers, for example, I think 65-70% will tell you, hey, I'm not going to switch doctors, even if someone is not available for many weeks. If you ask millennials that same question, you won't be surprised that it gets turned on its head. But 55% of millennials say, hey, I will switch my doctor if I can't get seen in a timely fashion. If that experience is not what I'm looking for. And so doctors and medical groups all over the country hear this, and they're starting to shift how they deliver care. And we're helping them accelerate some of those efforts and provide a digital layer on top of their operations to enable that.
Man, this is exciting stuff, Arun. So let's see. So if somebody's listening to this and they want to learn more about Radix Health, I mean, what's the best way for them to connect with the brand?
They can visit our website, which is Radix Health, RADIX Health.com. There's a ton of information about what we do and how we support groups all over the country.
Fantastic. Well, Arun, really appreciate you coming on the show today and sharing more about all the great work you're doing over at Radix Health to improve patient experience. And I'm excited because as I see things improve and get better and better, I'm like, I know some of the people behind the scenes working on these things. So that's awesome. And to the audience, as always, thank you for tuning in. Hope you got a lot of value out of this. If you did, don't forget to subscribe to the podcast, leave me a review on the Apple iTunes Store. And if you're watching this on our YouTube channel, Mission Matters Innovation, definitely give us a subscribe there, but also leave us some comments on the video. Love to know what kind of projects and things that you're working on. And Arun, thanks again for coming on the show.